Well, we continue to battle the COVID-19 pandemic, both here in central New York, across the country and the state. Vaccinations going on. Let's bring in our resident on all vaccine and COVID issues. He is Dr. Stephen Thomas, the head of infectious diseases at Upstate Medical University. It's a long title. Hey, Dr. T, how are you?
I'm good. How are you, Jeff?
Good. Let's start here. So there was new guidance out from the CDC today about people who are 2 weeks past their final shot. That means they're fully vaccinated, and their risk if they visit indoors. So what does this mean? What are you recommending? I also always keep in the back of my mind, you say, just because you can doesn't necessarily mean you should, but what do we make of this new guidance?
Yeah, so the first thing that I make of it is that people should read it. It's I'm not saying it's confusing, but it's complex and it's nuanced. And so kind of the big picture items would be that if you have people who are all vaccinated and 2 weeks beyond their last vaccine dose, the CDC is saying that it is safe for them to gather without social distancing and without masks. They go on to say that if you have unvaccinated people who are at low risk of a bad outcome if they get COVID, so people without risk factors for severe COVID, they can also gather without mask with people who are vaccinated. Now, both of these scenarios assume and they require that it's very small groups of people. So this is not very large groups of people. And so the last thing that I would say is that in any scenario where you do not know the people, and so you do not know what their status is, either from a risk of COVID or you do not know their status in terms of whether they've been vaccinated or not, full public health measures should be taken in those circumstances, meaning social distance, be outside if you can, or a well-ventilated area, and wear masks.
Will this be similar to what the CDC issued on travel, that if you're fully vaccinated up to 90 days from that last shot, that you don't have to follow all the testing and the quarantine? So are these types of rules good for 90 days, or we just don't know yet?
Yeah, I was looking for that in the guidance, and at least in the guidance that I saw, it was not clear. There were no stipulations as to time. What they do say, though, is that this guidance related to not needing to wear a mask did not pertain to travel, and that they had not changed any pre-existing travel recommendations.
We keep hearing 90 days, especially in those travel regulations. I've had people ask us, I mean, what does this mean? The vaccine's only good for 90 days, or we only have data up to 90 days, or why that 90-day number? Why does that keep sticking out there?
Yeah, I think it's a couple things. So one of the observations that we've made is that when people have a natural infection, it seems that for the period of 90 days, their risk of being reinfected is very, very low. So they make an assumption that immunity is quite strong for that first 3 months. The second thing is exactly what you mentioned, in that, the data from these vaccine companies, when they've filed for emergency use authorization, the data goes out to 2 to 3 months. And so I think between those two pieces of information, they're putting that together and basically saying, we feel confident with that 3-month period that the risk is quite low, for both those groups. And I imagine that as new information is, longer term follow-up is provided from the vaccine companies, that goalpost will probably move.
We haven't had a chance to talk to you, I don't think, since last week when Onondaga County came out with some new guidance for schools. One of the big things was that the desks, the distance between desks for kids can be reduced from 6 to 3 feet if they put up barriers. So how did we automatically go from 6 to 3, and can't the virus get around barriers, or is it barriers plus the masks plus other measures that can make this work?
Yeah, I mean, there's no one single thing that makes something go from a high to medium to low risk scenario. It's layering multiple things, right? So it's making sure that people aren't coming to school if they're sick. It's making sure that you de-densify people if you can, not having gatherings if they're not necessary. It's making sure people are wearing masks and washing hands. And in some cases, whether it's 6 feet or 3 feet with barriers, it's all of those things put together which dramatically lower the risk, which is why we don't believe that K through 12 schools are a location where there's lots of transmission occurring. That's one thing. I think the second thing is that the risk of kids not being able to go to school and the risk of kids not having in-person learning has taken on a whole new meaning, as we knew that it ultimately and eventually would. And so the risk, in my opinion, the risk of kids not going to school and not having the option for in-person learning is outweighing the risk of going from 6 feet no barriers to 3 feet with barriers, especially because of how we think that this virus is transmitted, which is big droplets within a short period of within a short distance.
Got time for one more. I'm going to ask you this. How worried are you about seeing some of these other states? Texas, for one, has gotten a lot of news saying, don't have to worry about masks. I know it's not the case in New York, but, you know, when people travel, the virus does too. I mean, it doesn't stay within boundaries, right? How worried are you about this don't wear masks mandate?
Yeah, you know, I don't think that it's really a good idea. I mean, there's a couple of things that are worrying me, you know, right now, and worrying that this, you know, at both a national level and a state level and a county level, this downward trend could have an inflection going the other direction. One would be, you know, more than 15 states in the country no longer having mask mandate. Two, in some of those states, the economy completely opening. Three, these new variants, which are much more transmissible and we know are starting to take off in the United States. And four, we still only have about 15% of the country who's received even a first vaccination. So we're nowhere even near to herd immunity through immunization. So those four things to me say we need to remain you know, vigilant, which if we do, we could all have a really good summer.
Dr. Thomas, you know it's always great chatting with you. We'll catch up with you soon.
Thanks.
See you, sir. Christy?